Here are 25 of the most commonly missed California life and health insurance questions. Can you get them right? These are the trickiest, most confused rules, and the numbers people most often misremember. Read each question, then answer before the 5-second timer runs out, and then see why. This is exactly how you practice on preppass.org. Let's begin. Question 1. A consumer enrolls in a California Health Maintenance Organization, HMO. Which state agency has primary regulatory authority over that HMO? A. California Department of Insurance, CDI. B. California Department of Managed Healthcare, DMHC. C. California Department of Public Health, CDPH. D. Centers for Medicare and Medicaid Services, CMS. The correct answer is B. Under the Knox-Keene Healthcare Service Plan Act, California HMOs are regulated by the Department of Managed Healthcare, DMHC, not the CDI. The CDI regulates indemnity health insurance and PPO products, but full-service HMOs fall under DMHC. Question 2. Under the Federal Affordable Care Act, a non-grandfathered group health plan must cover recommended preventive services with A. A separate $100 deductible. B. The same co-insurance applied to specialty care. C. No cost sharing to the in-network member. D. A flat $25 copayment per visit. The correct answer is C. Section 2713 of the Public Health Service Act, added by the ACA, requires non-grandfathered plans to cover certain preventive services, such as immunizations, screenings, and annual wellness visits, without imposing any deductible, copayment, or co-insurance when delivered in-network. Question 3. An employee voluntarily quits her job at a private company with 60 employees. Under Federal COBRA, the maximum continuation coverage period available to her is A. 18 months. B. 29 months. C. 36 months. D. 60 months. The correct answer is A. Voluntary or involuntary termination, other than for gross misconduct, and reduction in hours are qualifying events that entitle a covered employee to up to 18 months of COBRA continuation. The 29-month period applies only when the qualified beneficiary becomes disabled, and 36 months applies to dependent events such as death, divorce, or loss of dependent status. Question 4. CalCOBRA differs from Federal COBRA primarily because it A. Provides longer benefits to employees of large employers. B. Replaces Federal COBRA for all California residents. C. Eliminates the employee premium contribution requirement. D. Extends continuation rights to employees of small employers with 2 to 19 employees. The correct answer is D. Federal COBRA applies only to employers with 20 or more employees. CalCOBRA fills the gap by requiring continuation coverage from California group health plans of small employers with 2 to 19 employees, generally for up to 36 months total. Question 5. To be eligible to contribute to a health savings account, HSA, an individual must be covered by A. Any employer-sponsored health plan. B. A high-deductible health plan, HDHP, with no disqualifying other coverage. C. A health maintenance organization with a $0 deductible. D. Medicare Part A or Part B. The correct answer is B. Section 223 of the Internal Revenue Code requires an HSA-eligible individual to be covered under a qualifying HDHP and to have no other disqualifying health coverage. Enrollment in Medicare disqualifies a person from making new HSA contributions. Question 6. Under the ACA Metal Tier Framework, a silver plan must cover what approximate percentage of the average enrollee's covered medical costs, its actuarial value? A. 60%. B. Is 65%. C. 70%. D. 80%. The correct answer is C. The ACA defines four metal tiers by actuarial value: bronze at approximately 60%, silver at 70%, gold at 80%, and platinum at 90%. Catastrophic plans are separate and available only to certain enrollees. Question 7. A 45-year-old applicant with a history of diabetes applies for an individual ACA-compliant health policy through Covered California. The insurer may, A. Not deny coverage or charge a higher premium based on the diabetes. B. Exclude diabetes-related claims for the first 12 months. C. Charge a 50% surcharge for the pre-existing condition. D. Deny the application outright. The correct answer is A. Since 2014, the ACA has prohibited individual and group market insurers from denying coverage, charging higher premiums, or excluding benefits based on any pre-existing condition. Permitted rating factors are limited to age, geography, family size, and tobacco use. Question 8. Under the ACA, a group health plan that offers dependent coverage must make that coverage available to an enrolled employee's adult child until the child reaches age A. 19, B. 21, C. 23, D. 26. The correct answer is D. The ACA requires plans offering dependent coverage to allow enrolled adult children to remain on a parent's plan until age 26, regardless of marital status, residency, financial dependence, or student status. Question 9. Which of the following is not one of the 10 essential health benefits categories that an ACA-compliant individual or small group plan must cover? A. Maternity and newborn care. B. Adult dental and vision services. C. Mental health and substance use disorder services. D. Prescription drugs. The correct answer is B. The 10 essential health benefits include ambulatory services, emergency services, hospitalization, maternity/newborn care, mental health/substance use, prescription drugs, rehabilitative services, lab services, preventive/chronic disease management, and pediatric, not adult, services including dental and vision. Adult dental and vision are not required. Question 10. A health plan has a $2,000 deductible, 20% coinsurance, and a $7,500 out-of-pocket maximum. Once the insured reaches the out-of-pocket maximum, in-network covered services for the rest of the plan year are paid at A. 50% by the plan, B. 80% by the plan, C. 100% by the plan, D. 0% by the plan. The maximum has been used. The correct answer is C. The out-of-pocket maximum, sometimes called the MOOP, is the annual cap on a member's cost sharing for in-network essential benefits. Once it is reached, the plan must pay 100% of covered in-network services for the remainder of the plan year. Question 11. A key structural difference between a traditional HMO and a preferred provider organization, PPO, is that the HMO, A, requires a primary care physician, PCP, to coordinate care and generally has no out-of-network benefits except emergencies. B allows members to see any specialist nationwide with no referral or network limits. C always pays 100% of charges without any deductible or copayment. D is regulated only by federal Medicare rules. The correct answer is A. A core HMO feature is the gatekeeper PCP who coordinates and authorizes referrals to specialists. HMOs typically only pay for in-network care, with emergencies as the main exception. PPOs allow direct access to specialists and pay reduced benefits for out-of-network care. Question 12. An exclusive provider organization, EPO, plan is best described as a plan that A. Pays for any provider nationwide with no network restriction. B. Requires a PCP gatekeeper and pays partial benefits out of network. C. Combines Medicare and Medicaid benefits. D. Limits non-emergency coverage to in-network providers but typically does not require a PCP referral. The correct answer is D. An EPO restricts non-emergency benefits to the in-network panel of providers, much like an HMO, but unlike a traditional HMO, it generally does not require a PCP referral to see specialists. Out-of-network non-emergency care is usually not covered. Question 13. Which type of managed care plan combines features of an HMO, PCP gatekeeper, with limited out-of-network coverage at a higher cost share? A. EPO, exclusive provider organization. B. POS, point of service. C. A traditional indemnity plan. D. Self-funded reinsurance plan. The correct answer is B. A point of service, POS, plan blends HMO and PPO features. The member selects a PCP who manages and refers care, but unlike a pure HMO, the plan also pays a reduced benefit when the member uses out-of-network providers. Question 14. Which of the following best defines coinsurance? A fixed dollar amount the insured pays before benefits begin. B. A flat fee paid at each office visit. C. A percentage of covered charges the insured pays after the deductible is met. D. A separate policy that pays only the deductible. The correct answer is C. Coinsurance is the percentage share of covered expenses the insured pays, for example, 20%, after the deductible has been satisfied. The plan pays the remaining percentage. A deductible is the dollar amount paid before benefits start, and a copay is the fixed per-service charge. Question 15. The Federal Health Insurance Portability and Accountability Act, HIPAA, of 1996 primarily addresses which of the following? A. Protection of individually identifiable health information and continuity of group health coverage. B. Federal funding of Medicaid expansion in California. C. The structure of covered California subsidies. D. Mandatory enrollment of all individuals in Medicare Part A. The correct answer is A. HIPAA was enacted in 1996 to standardize electronic health transactions, protect the privacy and security of individually identifiable health information, PHI, and improve portability and continuity of group health coverage when workers change jobs. Question 16. Covered California is best described as A. A self-insured health plan operated by the state of California. B. A federal Medicare Advantage program. C. California's state-based ACA health insurance exchange offering qualified health plans and premium subsidies. D. A private association that sells short-term medical coverage. The correct answer is C. Covered California is the state-operated Affordable Care Act exchange, marketplace, where individuals and small employers can compare and enroll in qualified health plans and where income-eligible enrollees receive federal and state premium assistance. Question 17. As of 2026, California residents who go without minimum essential health coverage may face which of the following? A. Only the federal ACA shared responsibility penalty. B. A California state individual shared responsibility penalty assessed through the state income tax return. C. Suspension of their California driver's license. D. Automatic enrollment in Medicare. The correct answer is B. The federal individual mandate penalty was reduced to $0 starting in 2019, but California enacted its own individual shared responsibility penalty effective January 1, 2020. It is administered through the Franchise Tax Board and assessed on the state income tax return. Question 18. A flexible spending account, FSA, used to pay for qualifying medical expenses is best described as A. An employee-owned account that earns interest tax-free for life. B. A federally administered program that pays Medicare premiums. C. An account funded only by the employer that the employee may roll over without limit. D. A pre-tax employee salary reduction account subject to a use it or lose it rule, with only limited carryovers allowed. The correct answer is D. A health FSA established under an IRC Section 125 cafeteria plan is funded with pre-tax employee salary reductions and any employer contributions. Unused balances are generally forfeited at year-end, although plans may allow a limited carryover or grace period. Question 19. A health reimbursement arrangement, HRA, is most accurately described as A. An employer-funded, employer-owned arrangement that reimburses employees for qualifying medical expenses. B. An employee-funded savings account that earns interest like an HSA. C. An optional rider that replaces COBRA coverage. D. A type of long-term care insurance contract. The correct answer is A. An HRA is funded solely by the employer, not by employee salary reductions, and is owned by the employer. It reimburses employees, tax-free, for qualified medical expenses up to the amount the employer allocates, under rules in IRC Section 105 and IRS guidance. Question 20. Balance billing in a health plan context refers to A. The insurer's annual reconciliation of premiums. B. A bonus payment to in-network providers for meeting quality targets. C. A provider billing the patient for the difference between the provider's full charge and the amount the insurer pays. D. The patient's monthly premium bill. The correct answer is C. Balance billing occurs when a provider bills the patient for the difference between the provider's total charge and the amount the insurer pays as the allowed amount. In-network providers typically agree not to balance bill. Out-of-network or surprise billing scenarios are addressed by laws like the Federal No Surprises Act and California AB 72. Question 21. An employer that pays employee medical claims directly out of its own funds, rather than purchasing a fully insured group policy, is using A. A fully insured plan. B. A self-funded, self-insured plan, often paired with stop-loss/reinsurance. C. A Medicare Advantage plan. D. A guaranteed renewable individual plan. The correct answer is B. In a self-funded, self-insured plan, the employer assumes the financial risk for claims and typically buys stop-loss, reinsurance, coverage that caps the employer's exposure per individual claim and on an aggregate annual basis. Self-funded plans are generally governed by ERISA at the federal level. Question 22. A major medical health insurance policy is best characterized by A. Broad coverage for inpatient and outpatient services with a deductible, coinsurance, and out-of-pocket maximum. B. Coverage limited to dental and vision benefits only. C. Coverage that pays only for accidental injuries, not illness. D. A fixed daily indemnity benefit regardless of actual medical charges. The correct answer is A. Major medical insurance provides broad coverage for hospital, surgical, physician, and outpatient care subject to plan design features such as a deductible, coinsurance, copayments, and an annual out-of-pocket maximum. Limited benefit, accident only, and indemnity policies are distinct product types. Question 23. A health plan that requires the member to pay $30 every time they visit their primary care doctor is using which cost-sharing tool? A. Deductible. B. Coinsurance. C. Out-of-pocket maximum. D. Copayment. The correct answer is D. A copayment, copay, is a fixed dollar amount the member pays at the time of service, regardless of total charges. Deductibles are paid before benefits begin, coinsurance is a percentage share after the deductible, and the out-of-pocket maximum is the annual cap on cost sharing. Question 24. With respect to essential health benefits on an ACA-compliant plan, an insurer may impose A. A $1 million lifetime cap. B. A $250,000 annual cap on hospital benefits. C. No annual or lifetime dollar limits on essential health benefits. D. Only an annual cap, but no lifetime cap. The correct answer is C. The ACA prohibits both annual and lifetime dollar limits on essential health benefits. Non-essential benefits may still be subject to limits, but the 10 categories of essential health benefits, hospitalization, prescription drugs, maternity, etc., must be offered without dollar caps. Question 25. A spouse of a covered employee loses dependent coverage because of divorce. Under federal COBRA, the maximum continuation coverage period available to the divorced spouse is A. 18 months. B. 36 months. C. 60 months. D. There is no continuation available for divorced spouses. The correct answer is B. Divorce or legal separation is a qualifying event that affects spouses and dependent children. The maximum COBRA continuation period for such dependent qualifying events, including death of the covered employee or a child losing dependent status, is 36 months. Those are 25 of the most commonly missed life and health questions. This is exactly how you practice on preppass.org. Read, guess before the timer, then see why. The full free question bank for your exam is there. Just search PrepPass plus your exam. Good luck on your exam.